the patient. She's a 65-year-old lady. Okay. Her husband just passed away a few years ago, and she wants to start an exercise program. So I am the exercise professional, and she comes to me because she wants to start a program. And she says, I want somebody that, that has some background in exercise, not just one of these flunkies and so forth there. Okay? So, how are you today, Miss Macbeth?
I'm doing all right.
Doing good? How are your grandkids?
Oh, well, they're off in college and doing their things. They don't come to see me very often.
Oh, man. You look really good. You must be doing some good stuff, right?
Not too
Trying
much.
to stay healthy?
Just some walking in the neighborhood.
Okay. A little walk in the neighborhood. How you feel?
Old.
Old? You don't look old. You don't look old. So, you want to start an exercise program?
Yes, sir.
What got you on this?
Well, I have a lot of time on my hands, and I
Yeah.
want to feel a little better.
Doing a little online dating and and so, yeah, you want to start an exercise program, huh? Okay, well, good. I think we can work on something. So, so tell me, are you doing any exercise in the last 3 months or so?
Nothing too serious. Again, just the walking.
Okay, well, what do you like to do?
Not really much of anything.
You like dancing, walking? You have a dog? You like to walk the dog?
I have a dog and
You got friends you can meet?
a few.
A few? Okay. So, yeah, I think we can work something out. So, what about your health? Have you had any signs or symptoms of any chest pain or diabetes or anything like that?
I have some diabetes.
Okay, so you take medications for it and it's controlled? Okay. So yeah, I think in how you monitored your blood sugar. You take metformin? Okay, so you take metformin and you do the blood glucose test and so forth, and so it's in good shape. So yeah, you got, we call that signs of metabolic disease, but since you've got it squared away, you're taking care of it, you're good. You can exercise with that, and so probably we do some mild to moderate, mild type of exercise, and so and get you started on a program. And so, what about your heart rate? Does the heart go up, blood pressure go up when you exercise, or when you're out lifting those heavy water bottles out of your car and stuff?
Probably a little bit.
Okay, so you may have some. What about resistance training? Do you like to lift anything, or would you like to go into a gym where they have like equipment that you could get on and try to see if you could increase your muscle mass a little bit?
That'd probably be good to try, but I've never done it before.
Okay, so you need somebody that, like a personal trainer, or I can show you how to do the machines, and then you can get in there and play on the machines. And I know it's really intimidating. I talked to some other ladies your age, and they walk into the gym and they see all this equipment, and they say, I don't have a clue how to use any of that. And so it's not hard. And there's personal trainers. I don't know about your finances, but you could probably get one for maybe a session, maybe $30, $40, $50 a session. And so if you can afford that, that might be a good way to get started. Or we could just show you the basic kinds of things that would be good for you, and we'd probably pick out about 8 exercises that we could set you up on, and we'd have you do not real heavy weights. We'd have you do about 8 to 12 repetitions and so forth, and just see how you did when you started your thing. Because as we get older, we tend to lose a little muscle mass, And that can be serious with women and men, but especially women because they have less muscle mass to begin with. So we can get you on a program, and then probably a couple of days a week we do the resistance exercise, and you know, we're not trying to make a bodybuilder out of you, but we're trying to improve your fitness, and then maybe some balance kinds of things. And so, do you like yoga, or you ever tried it?
I've done some Pilates before.
Oh, cool. Little Pilates, and so that's similar to yoga. So we could find a good Pilates class that you could do. There's some online, but we'd like to have you in a gym or someplace where you'd have supervision, and could do that. So we can do some Pilates, and we get you on a little resistance program, and then we get you on a walking program, and you know, you might want to go out and do some dancing, or do some other type of aerobic type of exercise. So and we can work it out based upon the American College of Sports Medicine guidelines, because you know, you always need to let us know if you're having problems, if you're having chest pain, or if you're difficult breathing, or any of those kinds of things, because then we would check with a physician, and we can get a good physician and get a checkup if you had any signs or symptoms of cardiovascular disease. So what else would you like to know?
How many days a week do I need to
Okay, the national guidelines are 30 minutes, 5 days a week. Okay, so we'd like to get you doing something every day. And we know that's hard sometimes, but you can do 10 minutes here, 10 minutes there, and so forth. And so you can do 15 minutes in the morning, 15 minutes at night. And then we can get you working out with we need to find some friends for you. And so, you know, it gets lonely. You know, you lost your husband, you're by yourself. The environment's different. Your kids aren't seeing you a whole lot, and so you probably be good to have somebody else there. That's why some gyms are good, because they provide backup and support. AUM has a gym. It's not open now, but when we let the community in, we always have a lot of people from the community, and you can talk with them, get to know them, and so forth. The gyms now, like Planet Fitness or so forth, you're pretty much just going there, you're pretty much on your own. And so, unless you got some friends or something like that to go in there with you. So, yeah, I'm glad to see you starting an exercise program. And so, I think you're at a good age to start a program. And then as you progress, we'll see how it goes. And then, you know, maybe you can set a goal of maybe doing like a walk and a 5K. And that'd be fun, because there's a lot of social stuff out there, and it's a fun. It's like a party that you go to, and we're not talking about running marathons. The average 5K for even a runner is like 35 minutes, and so we can look at how fast that is a mile, and then set you up on that. And they have a lot of good organizations that fundraisers for the Heart Association and Cancer Society and so forth. So a lot of things that you can do. So yeah, so you're looking good, and we're going to get that exercise program. Now remember, when you start the program, you're going to feel a little sore, and your weight may go up a little bit, and you have any issues or whatever, like ankle, hip, or whatever, slack off a little bit, and then let's talk about those problems, and then make sure that you don't get any injuries or whatever, because I don't want to hurt you, and so I want you to do well on the exercise program. Okay, so you're good to go, and we'll get you started, and you're gonna live to 150 years old, right?
Hopefully.
Okay, so that's a little role play, and one of the important things is to communicate with your person, right? And that's fun, right? And so I'm not an extrovert. I'm more of an introvert than an extrovert. But when you talk about exercise, I can be more extrovert, right? Okay. And so you'll get in groups of about social distance, but get in groups, and then we'll let y'all do some role play with each other. And so get in groups of about no more than 6 in your group. Then I'll tell you what to do.
Trying to pop on over.
Clayton. That's 4, that's good.
Yeah. You gotta be in a group.
Yeah,
You get in the smart girl group. Huh? Okay, y'all get in your groups. Hema hobby. You know what Hema hobby is? It's Indian talk for hurry up. Okay, I'm gonna give you some scenarios. Okay, one of you is gonna be the exercise professional. The other is gonna be the subject. Okay, the first one is the 70-year-old grandmother wants to start an exercise program, does not exercise, likes to dance, wants to get fitter, has high blood pressure, takes medications, and lives by herself. Similar to what we did. Okay, so get your chart out right there in terms of exercise, not exercise, or whatever, and you'll ask the questions, and then the role player will answer the questions, and then you go from whatever, how they respond to the questions, and you go, and that's your next thing. So, 70-year-old grandmother will start an exercise program, and this is common because in my age, this is the kind of people I see. Exercise program, currently does not exercise, likes to dance, wants to get fitter, has a little high blood pressure, takes medications, lives by herself. Okay, so y'all play with this a little bit and see. One of the things